Hello everyone. Welcome back for the third part of the webinar series. Thank you for joining today for this presentation on the latest updates on ICD-10-CM for the financial year 2023. This is the third and final part of this three-part series. We will cover the updates in a chapter-specific format, which will make it easy for everyone to understand the important updates for the year 2023. So, this is the third and final part of the updates, and we will cover all the important updates from chapter 14 to chapter 21 of the ICD-10-CM code. We will review the changes for the financial year 2023, including the addition of new codes, deletions, and updates in the guidelines and conventions for these chapters from chapter 14 to chapter 21. Now, in the previous session, we covered updates for categories of codes related to candidiasis of the vulva and vagina, infection associated hemolytic uremic syndrome, von Willebrand disease, non immune heparin induced thrombocytopenia, short stature due to endocrine disorder, code updates related to dementia, alcohol and drug usage code updates. This is what we covered in part 1 of this series. And in part two of this series, these are the categories of codes that we covered from chapter 6 to chapter 13. The most important changes are for limb girdle dystrophies, refractory angina pectoris, thoracic and abdominal aortic aneurysms, lumbar and lumbosacral annulus fibrosis disc defects, slipped upper femoral epiphysis, and rib fractures due to cardiopulmonary resuscitation. This is what was covered in part 2 for the most important updates for 2023. I'm Vinay Kumar, and I come from a medical coding, billing, and documentation improvement background. With over 20 years of experience in the US healthcare industry, I have been part of different projects and departments, which include medical coding, medical billing, and client servicing. I'm dual certified from both AHIMA with the CCS certification and from AAPC with the CPC certification. I have trained many professionals in medical coding and I've helped them in gaining knowledge and also getting their certifications done. So, for the financial year 2023, the Centers for Disease Control has issued ICD-10-CM updates, which include a total of 1176 new codes, 28 revised codes, and 287 codes. These 2023 ICD-10-CM codes should be used for inpatient discharges that occur from October 1st, 2022 through September 30, 2023. And these are also applicable for patient encounters occurring from the same dates from October 1st, 2022 through September 20, September 30, 2023 for outpatient encounters as well. So this year, the primary focus is on a few categories of codes, including dementia, endometriosis, maternal care for fetal disorders, certain head injuries, and social determinants of health. These are the five categories of codes where majority of the updates or the important updates have actually occurred. There are other sections as well, but then these are the ones which were predominantly highlighted. We will talk about these in detail in the following slides, and we'll also look at the changes by each chapter of the ICD-10-CM. I will try and cover all the important updates throughout this presentation. So, beginning with chapter 14. For chapter 14, diseases of the genitourinary system, code categories N00 to N99. Endometriosis is one condition from this chapter which received a total of 135 new codes, which is pretty huge for a single condition, ideally, right? So, endometriosis. So, this is a condition in which the tissue cells that are similar to the lining of the uterus or the endometrium actually grow outside the uterus. This condition usually involves the pelvic tissue and can envelop the ovaries and fallopian tubes as well. So the nearby organs such as the bowel and bladder are also affected with endometriosis. The most common sites for endometriosis include the ovaries, the fallopian tubes, ligaments that support the uterus, the cul-de-sac, or otherwise known as the spaces between the uterus and rectum, and also the uterus and bladder. That's the cul-de-sac. Also, the lining of the pelvic cavity, and also on the outer surface of the uterus. These are the most common sites for the endometriosis to occur. Now, when it comes to the code updates, the new codes for endometriosis will now provide additional specificity and other details in terms of laterality, like for example, endometriosis of the right ovary or the left ovary, or whether it is bilateral ovarian endometriosis. Then again, these codes also include the location and depth of the invasion, whether it is superficial endometriosis or whether it is deep endometriosis. Similarly, if you ask about superficial endometriosis, so superficial endometriosis is actually ectopic growth of endometrial like tissue that extends from 5 millimeters or less. This is below the peritoneal surface. Okay, and these lesions, these endometrial lesions can vary in number. They can be present in a single location or in multiple locations. And on the other hand, deeply infiltrating endometriosis or deep endometriosis involves ectopic growth of endometrial like tissue that extends greater than 5 millimeters. So if it is less than 5 millimeters, it is superficial. And if it is greater than 5 millimeters below the peritoneal surface, it is deep. These lesions are commonly associated with deep fibrosis and adhesions. Now, when coding for endometriosis, if either deep or superficial is not documented, then look for any indication of how far below the peritoneal surface the tissue has extended. This will be essential in selecting the code correctly under the new 2023 ICD-10-CM update. So you'll need to know whether it is superficial, less than 5 millimeters, or deep, greater than 5 millimeters. That's the essential part of it. The volume of disease and specific organs involved in the endometriosis is also now covered under these new codes. Okay, so the location, so the laterality is identified, the location and depth of invasion is identified, and the volume of disease and the organs involved is also identified as part of these new codes for endometriosis. The next chapter, chapter 15, pregnancy, childbirth, and puerperium. So for chapter 15, category O35 has been expanded and a total of 175 new codes have been added for the financial year 2023. The Society for Maternal Fetal Medicine, SMFM, and the American College of Obstetricians and Gynecologists. These two institutions actually requested that the category O35 for anomalies, which includes central nervous system anomalies, chromosomal anomalies, and fetal abnormalities and damage, these categories should be expanded to provide additional specificity for appropriate diagnostic coding. Okay, and also to assist in measuring the incidence of these specific anomalies, which is a very valuable information from a public health point of view. So this will allow, the expansion of these codes will allow tracking, measurement, and ultimately improve the treatment modalities for all identified fetal abnormalities or anomalies. Now, birth defects affect 1 in every 33 babies, which is about 3% of all babies that are born in the United States each year. That is the reason this is a significant change, the category O35. So the new codes from the category O35 between O35.0 to O35.h. These codes now represent a specific code assigned for the most common fetal abnormalities, which are classified by the organ system. Now, this is just an example of codes that I've listed here. I cannot list out all the codes because it's pretty huge. Okay, so codes from the fetal abnormalities category now include codes for central nervous system abnormalities such as agenesis of the corpus callosum or anencephaly or choroid plexus cysts or encephaloceles or you can talk about hydrocephaly or microcephaly, and spina bifida as well. These are the different types of conditions that are identified now. Okay, now this category also includes specific codes for chromosomal abnormality in the fetus, and also further specifies the conditions such as whether it is trisomy 13 or trisomy 18 or trisomy 21, or whether it is Turner's syndrome, or whether it is sex chromosomal abnormalities. And there are also codes for fetal anomalies by body areas or organ systems. For example, like facial anomalies or cardiac anomalies or pulmonary anomalies, gastrointestinal, genitourinary, musculoskeletal anomalies, upper and lower extremity anomalies. This is how these codes are the category of codes from 035.0 to 035.h have been expanded to identify multiple informations. The next chapter, chapter 16, certain conditions originating in the perinatal period, has one update for codes related to apnea and sleep apnea of the newborn. There are 10 new ICD-10-CM codes which were created for the financial year 2023 to identify the specific types of sleep apnea and apnea of prematurity. This apnea of prematurity is something which occurs outside of the sleep. So, based on respiratory effort and airflow, apnea is actually classified as central, which is cessation of breathing effort, or obstructive, which is airflow obstruction, usually at the pharyngeal level, or mixed kind of apnea. Apnea of prematurity is a developmental disorder that is caused by immaturity of neurologic or mechanical function of the respiratory system. Next, for chapter 17, congenital malformations, deformations, and chromosomal abnormalities. There are 12 codes which were newly added for atrial septal and atrioventricular septal defects. Currently, in ICD-10-CM, both atrial septal defect and patent or persistent foramen ovale or PFO are classified within the same ICD-10-CM code. Atrial septal defect is considered a major complication, and patent foramen ovale is considered a normal finding in the immediate newborn period. These conditions also have different clinical implications and treatment plans. So, the 12 new ICD-10-CM codes that are created for 2023 now specify the type of the atrial and atrioventricular septal defect. Adding granularity to ICD-10-CM codes, the codes Q21.1 and Q21.2. These will drastically improve the data quality and accuracy of the defects, allowing researchers and other surveillance staff to analyze and understand the defects very thoroughly. So these are the codes which were introduced for atrial septal and atrioventricular septal defects as part of chapter 17, congenital malformations, deformations, and chromosomal abnormalities. Under Chapter 16, certain conditions originating in the perinatal period, apart from atrial septal defects, four additional codes have been added to Chapter 16. Code Q85.81, this is for P10, PTEN tumor syndrome. Code Q85.82 is for other Cowden syndrome. Code Q85.83 is for one Hippel-Lindau syndrome, and Q85.89 is for other phacomatosis. Von Hippel-Lindau syndrome as an example. Okay, this is an inherited or genetic disorder that is characterized by the formation of tumors and fluid-filled sacs in many different parts of the body. So these are four new codes that were added to this chapter. Next is chapter 19, injury, poisoning, and certain other consequences of external causes. So from chapter 19, the first category of codes which received new codes is for intracranial injuries. Code category S06. Now, under category S06, there are 35 new codes in this category for intracranial injuries. These new codes now describe conditions such as whether it is a concussion or a traumatic brain injury or a blast injury or cerebral edema and hemorrhages to specify if the status of loss of consciousness is not known. So there are different kinds of things which were introduced into this category. Now, the previous set of codes only identified whether the patient had loss of consciousness or not. So, these new codes now will be helpful in coding situations where the status of loss of consciousness is actually not known. Previously, it was either the patient had a loss of consciousness or did not have it. But the new category of codes will identify also cases where if it is not known whether the patient actually had a loss of consciousness or not. That's the most important thing in this update. I have listed the codes here specifically for primary blast injury of the brain from category S06. If you look at these codes, the blast injury codes, okay, these were actually requested by the Department of Defense and the Department of Veterans Affairs in March 2021. And these types of injuries, blast injuries, uh, are generally or commonly seen in members from the veteran services or the defense services primarily. Okay, so codes from S06.8A1 are for primary blast injury of the brain with loss of consciousness 30 minutes or less. If you look at code S06.8A2, sorry, these are for primary blast injury of the brain with loss of consciousness of 31 to 59 minutes. Now, similarly, code S06.8A3 is for primary blast injury of the brain with loss of consciousness from 1 hour to 5 hours 59 minutes. Similarly, S06.8A4 is for loss of consciousness of 6 hours to 24 hours. Then you have codes from S06.8A5, which is for loss of consciousness greater than 24 hours with return to pre existing conscious levels. So, the amount of loss of consciousness is also identified as part of these codes. And remember, the seventh character is always required for this entire category, whether it is initial encounter A, subsequent encounter D during the treatment phase, and then the sequel or the complication with the seventh character S. These are applicable for all the codes from this category. This is for blast injuries of the brain, the category S06, where it has been expanded further. Now, another category that received updated codes from Chapter 19 is for poisoning by adverse effect of and underdosing of methamphetamines. These are currently classified in ICD-10-CM under the code category T43.62, poisoning by adverse effect of and underdosing of amphetamines. Now, T43.62 is actually not specific to methamphetamine, and that is the reason 18 new codes ranging from T43.651A to T43.656S were created for the financial year 2023, specifically for methamphetamines. Now, these new codes now specify if the methamphetamine poisoning was due to self-harm or accidental usage or assault or undetermined cause. They also identify whether it is poisoning, adverse effect, or an underdosing of the methamphetamine. Chapter 20. So, Chapter 20 now has codes that identify the external causes of electric bicycle injuries. Over 470 new ICD-10-CM codes were created for financial year 2023 to specify if an accident is due to an electric assisted bicycle. Currently, ICD-10-CM is not suitable for e-bicycle injury surveillance at the local, state, or national levels, and introduction of e-bicycle specific external cause codes will reduce the likelihood of misclassification. These codes now have a broader usage to identify whether the injury was due to collision with a pedestrian or an animal, whether it is a traffic versus non traffic accident, and also whether it is the initial encounter, subsequent encounter, or whether it is a sequela. This is for, as part of the external causes of morbidity. Now, chapter 21, which is the last chapter that received an update in ICD-10-CM this year, factors influencing health status and contact with health services. This chapter has received updated codes related to social determinants of health. Three new codes have been added to category Z55 to Z65 for persons with potential health hazards related to socioeconomic and psychosocial circumstances. Code Z59.82. This will identify transportation insecurities such as excessive transportation time or inaccessible transportation or inadequate transportation or lack of transportation or unaffordable transportation, unreliable transportation, and unsafe transportation. These are transportation difficulties, generally insecurities. Similarly, code Z59.86 will identify financial insecurities such as bankruptcy, burdensome debt, or economic strain, financial strain, money problems, running out of money, unable to make ends meet. This is for Z59.86. The third code Z59.87 will identify material hardships such as material deprivation, unable to obtain adequate childcare, unable to obtain adequate clothing, unable to obtain adequate utilities, and unable to obtain basic needs. These are three codes which were updated as part of social determinants of health Z55 to Z65 categories. Apart from these, codes for social determinants of health, Z codes for long term use of immunomodulators and immunosuppressants have been introduced. Category Z79 now has codes that identify long term current use of immunomodulators and biologic immunosuppressive drugs. Calcineurin inhibitors, Janus kinase inhibitors, and many other immunosuppressants that are used on a long term basis are all coded to this category Z79. Now, there are also many new codes and inclusion revisions to the existing codes in categories Z71, Z72, Z79, Z87, and Z91. These provide additional granularity for factors preventing quality care to the patient. So, these were the updates for chapters 14 to 21 for the financial year 2023. I have listed the links here where you can find the comprehensive list of ICD-10-CM files for the year 2023. You'll also find the updated guidelines, complete list of codes, along with their descriptions and other relevant data from these links. I hope you enjoyed the video. Please subscribe to the channel and support the channel so that I can make a lot of videos that would be helpful for all the coders, whether experienced coders or for beginners. In my next video, I'll cover the upcoming changes for CPT in terms of E&M coding, what is changing for 2023. I'll also cover CPT updates for the year 2023 comprehensively. And there are many more specialty specific coding updates which would be implemented from January 2023. For example, emergency department. So I'll be walking you through all these updates for 2023 in my next video. Thank you.